femoral nerve flossing becomes an effective drill to reducing tension, oftentimes that develops within hip flexors as well as the quads. A lot of times people simply resort to stretching, but there may be a deeper root cause to your tightness in those muscle groups. And oftentimes it's because we have tension that's being placed on the femoral nerve and that it's not sliding as it should during movements such as like hip extension or hip external rotation or internal rotation, and therefore it's causing a snag that's resulting in increased muscle tension that becomes more of a protective tension in order to protect the integrity of the nerve. So to help reduce some of that tension on the nerve and improve that range of motion that otherwise you might try to accomplish simply by stretching it, we're gonna use a chair here. In order to get that femoral nerve to slide better, we have to put ourselves kind of in a little bit of hip extension. We're gonna be in knee flexion, and we're gonna keep this foot elevated. If your foot was simply down like this, it's not gonna create the same effect. So whether you use a chair or if you're at the gym, you can go to the floor with the knee and maybe prop your foot up on a bench behind you and get this same effect. Now, from there, what we're gonna do is we're gonna take the same side arm. So my right leg, we're gonna target the femoral nerve to get a little bit more complete tension through the nervous system. I'm gonna raise my right arm up overhead, maybe place my hand on my neck or right on my upper back, depending on your range of motion. And from there, what we're gonna do is we're gonna do a little bit of a lateral glide to the right, okay? So we're creating a little bit of a more opening here in the front side of the hip. Allow those nerve roots to get some traction and flossing in that direction, and we'll back it off. And we can repeat this anywhere from 10 to 20 times. Certainly you can perform this on both sides. If in this case I'm having more symptoms from whether it's a tightness, pain, or numbness and tingling in the femoral nerve distribution on my right leg, there certainly could be benefit by performing this on the left side because of the connection of the nervous system. So if you happen to want to do this drill on both legs, there's really no harm in doing that. It might even benefit you, especially on the leg that's more symptomatic, to do the opposite or unaffected leg. So there it is. Give it a go. If you happen to have any questions regarding this, please submit your questions to us here on YouTube. But as always, when it comes to treatment techniques such as neuromobilizations, it's always best to be evaluated by a licensed healthcare provider to know if this technique is appropriate for you and your condition.